Well, from Kelly Preston announcing her pregnancy at the age of 47 to Celine Dion expecting twins at the age of 42, more and more Hollywood stars are having babies later in life. But is this a good message to send to women? Is it encouraging or giving them false hope? Joining us now is Dr. Bruce Shapiro with the Fertility Center in Summerlin. You are basically a renowned fertility expert and know a lot about this topic. We've seen this the last couple of years, but recently, just the last few weeks, more and more stars over 40 announcing they're pregnant.
Yes, I've noticed.
I'm sure you have.
Actually, you know that it's very common now. We're being able to push the envelope so women can get pregnant at later and later ages.
That's great news because a lot of people are going after their careers now, and women are postponing marriage and pregnancy till later in life. So do you think this is encouraging news, seeing this happen?
I think it's very encouraging. Women can see that if others can do it, that they can do it.
Yeah.
And right here in Nevada, we have the best fertility clinics that are imaginable. So at our personal center, we can do just about anything that can be done anywhere in the world.
So things that couldn't happen maybe 10 or 20 years ago are happening now because medicine has really progressed so much.
That's true. That's true. And this is great to bring awareness to other women who may have that problem and have heretofore been a little bit shy about bringing their problem to a fertility center.
Now, the flip of the coin is, of course, we've always heard that the younger you are, the easier it is to conceive, the less risk you have for the mother and the baby. Is there any trouble in seeing so many Hollywood stars? Is that going to push some women to postpone pregnancy and then, at their own peril and have problems later on?
That's an excellent point. And one of the things that we want to get across to women is that as they get older, it's going to get more and more difficult to get pregnant. And as it gets more and more difficult to get pregnant, it's also going to be more and more difficult to stay pregnant, because many of the things that happen to women as they age happens to their eggs as well.
Sure.
And when it happens to their eggs, it results in abnormal embryos that tend to have miscarriages at an earlier and earlier stage than in earlier life. So we're particularly concerned about women who are putting off childbearing. So while it's good to know that we have treatments that are available
that's possible, yes,
for women who are older, we really encourage them to get pregnant when it's appropriate for them at an earlier age.
Now, if all things, in your dream world, what would you say is the best time biologically, physically for a woman to be pregnant?
In the mid-20s.
Oh, Lord. Well, doctor, I think I passed that up a few years ago. But again, like after 35, you say that's when things become difficult. But like you said, not impossible.
It's not impossible. And we encourage women to come in and seek treatment as soon as they determine that they want to get pregnant, especially when they're over the age of 35. Or if they're younger than the age of 35 and they know they have some problems already in existence.
Yes.
They need help quickly, because we don't want time to pass while they're trying and having a very difficult time while their eggs are getting older and older.
Sure.
And the possibility is getting less and less that they're going to be able to ultimately conceive.
So know your facts, but again, having these women come forward and saying they're pregnant over 40 is encouraging to a lot of women out there who are past 35. So there is hope for sure.
There is hope.
Great.
There definitely is hope.
Well, wonderful. Dr. Shapiro, thank you so much. We know your Fertility Center is top-notch, doing some great things. So obviously find out more at the Fertility Center in Summerlin. And Aaron, do you have baby fever? You just got married recently.
Yeah.
I'm just saying. Can we see some Aaron Jr.?
Was there a question there? Go ahead.